Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. And our guest today is Jill Evans. She's Chief Nursing Informatics Officer at MetroHealth. Welcome, Jill.
Thank you. Thanks for having me. I'm really happy to be here.
Yeah, excited to hear. I always love nurses. We've had a number of nurses over the years. I love your perspective, but you're also working on a really interesting project that we'll get to. But before we go there, tell us a little bit about yourself and Metro Health.
So I've been a nurse for a little over 30 years, primarily trained in the emergency room, but I've been in informatics for the past 15 years and became the CNIO here at MetroHealth about 4 years ago. I'm responsible for ensuring our technology and data and digital strategy supports our nursing practices. We want to improve our patient care and advance our organizational goals. A little bit about MetroHealth. We're a safety net hospital in Cuyahoga County with the region's most experienced level one trauma center. We include 5 hospitals, 4 emergency departments, and about a dozen healthcare centers throughout our county.
That's awesome. I love that they have a chief nursing informatics officer. Not everyone does. So the
I
fact you've
am
done it
too.
15 years, that's impressive. Love it. Awesome. Well, you recently decided to deploy the Artisight Smart Hospital Platform. Talk to us about what went into the decision to deploy that platform and what were the challenges you wanted to solve and maybe some of the benefits you were looking to achieve.
Yeah, it's been a real journey for us. Like a lot of other healthcare organizations, MetroHealth faces, ongoing pressures to reduce some of that nursing workload burden. We want to constantly look for technology or other features that allow us to improve our patient safety, and we want to be able to deliver throughput improvements. So as we were looking through for the platforms, we really started looking for what will define our success and what metrics are we looking for. And so, we want to decrease the workload burden of the nursing staff. We want to implement solutions that strengthen our patient safety programs. We want to be able to increase our patient and nursing satisfaction. We have an existing virtual nursing program today, but we wanted to make the interactions and the integration of that virtual nursing more seamless and easier both for the patients and the bedside nurses.
Interesting. I love that you started with the outcomes, not the technology, which I think sometimes people screw up, right? It's like, what outcomes do we want? And then what technology fits it? So what are some of those features that you're excited to use in the Artisight platform?
Yes, so we're really looking forward to it, like I mentioned, enhancing our virtual nursing program, and just making it easier for those virtual nurses to contribute to the patient experience and the care model that we're providing. We're excited about a lot of the AI powered falls monitoring and the voice command capabilities that will be able to anchor our new virtual observation program. The features are really just the beginning. I feel like once the technology is in the room, we are so excited to be able to support our patients and their families in different ways, and providing them a different patient and family experience.
Interesting. I mean, as we said, you're a nurse, so I'm interested to hear like what's been your reaction? What's been the staff's kind of response to this decision and platform? Especially the nurses who are probably most impacted by it.
So the staff from both the inpatient areas and our virtual care space has been really engaged, and they've really contributed to helping us design the future of the care model. They're very excited about it. They are really liking the contributions that they are able to provide, and that just helps us ensure adoption at the end. The nurses have to
Okay.
be involved
Hmm.
for every step of the way.
Yeah. No, I mean, if you don't have the buy-in and the nurses want to fight against anything, right? You're in trouble from the beginning. There's no doubt. Well, I'm surprised we haven't mentioned the word AI yet. So I guess we'll throw it in here. Like, how important were some of the AI features that are part of the Artisight platform as far as your decision-making process and even probably the desire to incorporate some AI and benefit from the AI that's coming?
So we really wanted a platform that directly connected to our existing clinical workflows. We didn't want to create anything super new, right? We want to make sure our vendor systems, like our EHR, our nurse call, our communication systems, all integrated really seamlessly into this platform. It was important for the technology to enhance the care that we were providing our patients, to make their stay safer, continue to support the bedside nurses, and find a partner to transform what I would call a traditional care setting really to an innovative space that supports our patients' healings, our nurses' efficiency, and patient and nurse satisfaction.
Yeah. As a nurse, and I mean, and an informaticist now, as much as a nurse, I think, over all these years, like, what's your perspective on AI, and how are you approaching and kind of evaluating all of the different AI solutions out there?
I'm really excited about AI. I feel that AI can assist our caregivers to provide a more attentive and personalized care. AI is going to allow us, like I said, to transform that traditional care setting into a really innovative space for our patients and their families. It's really important, though, that the AI is assisting our caregivers. It's not going to replace our caregivers in any way, shape, or form. We have really focused here at Metro on developing a strong AI governance process. I think it's imperative to have something around AI governance within a healthcare system. That way, we can make sure that the AI we're bringing in is solving a problem. And like you mentioned earlier, we're just not putting AI in because it's available for us. We want to make sure that, we are very thoughtful about where we are putting our AI, and we aren't just putting technology in for technology's sake. We want to ensure that the AI is safe and that we have a really good understanding of what data is being used or not used and how the AI is functioning within our system.
Interesting. I've had this conversation with a lot of people as far as governance and the importance of governance. Did you decide to create an AI governance committee? Are you using your existing committees? Kind of, how did you approach kind of the governance of AI and selection and evaluation process?
We have two really strong AI leaders within our organization, and so we opted to create a separate AI governance structure outside of our normal, what I would say, technology governance structure. And
Yeah.
it's been very helpful. We have a very diverse group that is participating so that we get all perspectives on the AI that we are looking to implement. They have really thoughtful questions. It's really great discussion, and it's been extremely helpful as we start to implement more and more AI into the system.
Yeah. It's interesting. There's almost a pace that's different for AI than regular tech that probably needs a separate committee. But anyway, it's interesting to see how people are approaching it. What would you say are some of the tech realities for nurses that maybe not enough people are talking about, that maybe people don't understand if they haven't spent time on the floor, but maybe we should be talking about it more?
Yeah, I think there's a lot. In the informatics community, you're hearing us talk a lot about making sure that the clinician or the nurse is involved in the tech decisions. I mean, that's kind of basic, but super important. They bring that frontline perspective that's really needed to help us define the problem that we're trying to solve. They bring a different perspective from evaluating the technology on whether or not it's going to be useful or a burden to them. And that those decisions help ensure their adoption. If it's a piece of technology that they are going to utilize, if it's easily within their workflow and it provides a benefit, they're going to use it. And so it's really crucial to have our nurses and our clinicians involved from the very beginning.
Mm. Yeah, that's a good point. I think, we've talked about this, a lot on the CIO podcast, that many of the technologies were done to us and added extra burden because you were requiring more things. But I think there's this trend that the AI is offering some relief, and then they want that solution, not just have to do it because you required it for some government regulation. So
Right.
it feels like a shift's happening. Well, as we wrap up, we always like to end with a little career discussion, career advice. I'd love to hear from you. Like, what advice would you give a nurse that may be interested in informatics and or may want to be a CNIO like you?
When I think back about as I got into nursing informatics, and the nurses that we have on our team. I feel for a nurse that's starting to get, that is interested in trying to figure out how do I get my foot in the door? Really start to look at your clinical informatics council or nursing informatics council. That way you're starting to get involved with the informatics team, you're understanding the work that you're doing, and you're starting to contribute. Maybe for some features within the EHR that your unit is looking to implement, or a quality project that's using the data that we're pulling out of the EHR, really kind of getting in at that base level and contributing within a council is a great way to kind of start to understand the informatics team at your organization and some of the work that they're doing. If you're already in informatics, and kind of looking to grow and be a CNIO, I thought about this a lot. I would say, like, don't skip out on any opportunities that come your way, whether it's participating on a project, maybe being a stretch assignment to be a project manager, presenting at a conference, or looking to build a new skill. You sometimes do have to advocate for yourself to get into that class or to attend a conference or to learn or join a committee or a group. Um, where you can learn and build your community. And never stop learning. Never stop learning, whether it's within informatics or a new piece of technology, a new skill. Being able to learn and grow just continues to help you develop, and then also helps you help the staff that you're working with.
Yeah. Well, and that's one of the best parts of life is keep continuous learning, I think. So that's great advice. Say yes and be ambitious and advocate for yourself. I love that. Well, Jill, I appreciate you taking time to talk with us and share your insights and perspectives. Excited to see how things go with your new Artisight platform and all your efforts to leverage AI to improve the lives of patients and obviously the staff who serve those patients. So, thanks so much, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting applications. Thanks, Jill.
Yeah, thank you so much.